I think the biggest issue that we have to look at is that there are causation of mitochondrial dysfunction that occurs by taking medication. Now, I'm not saying that medication is bad. It's just that there's always a pros and cons of taking it. So my overall point of view as a pharmacist and as was working within the functional medicine space is that when you're taking medication, you have to know that there are risk and reward in taking it, number one. Number two, is there a long-term issue by taking these drugs because of something called drug-induced nutrition depletion? And third is there a way to combine with other nutraceuticals to enhance the effectiveness of the medication, because it is still a tool. And if you're taking from medication to nutraceuticals or vitamins or supplements or herbs, there's still a toolbox for clinicians to utilize. But how can we combine all these things to enhance the effectiveness, number one, or can we take the natural approach to replacing your pharmaceuticals to give you the more benefit of that?
Welcome back to another episode of the Smarter, Harder podcast, where we give you 1 cent solutions to $64,000 questions. I'm your host again today. My name is Dr. Scott Scher, and it's a pleasure to be back with all of you. So today I had the amazing experience and fun time interviewing a friend of mine and a colleague and a very, very smart pharmacist named Dr. John Kim. John and I had a tour de force about multiple different things throughout this podcast that I think is going to be super entertaining and interesting and educational. Here's a quick bio on John. So he is a doctor of pharmacy from the Ernest Mario School of Pharmacy and Rutgers University. He's a full fellow in anti-aging and regenerative functional medicine from the American Academy of Anti-Aging at A4M. He's a Defeat Autism Now practitioner. He is also the present owner of Robinson Wellness Pharmacy in Mendham, New Jersey. And Dr. Kim Welles, he's a functional medicine consultant specializing in hormone, dysfunction, and gut health. He has expertise in training practitioners in phytocannabinoid medicine. He's won a bunch of awards as well. So he is really a pioneering functional medicine pharmacist and advocate for holistic health. And I've known John for a number of years. He's a big fan of Methylene Blue, of transcriptions, and some of the stuff we do there. And I wanted to have him on today because he's really good at understanding nutrient deficiencies in medication management, because he does a lot of medication management, or at least has in the past as well. So we had a tour de force here. We talked about statins, we talked about PPIs, H2 blockers, SSRIs, oral contraceptive pills, Tylenol, antibiotics. We talked about fluoride in so many different types of these medications, which I didn't know of. And actually, this is very interesting to me. And we know that fluoride is a mitochondrial toxin. We talked about being floxed, which is the use of fluoroquinolones and having toxicity. From there, we talked about methylene blue and how he's combining it with LDN, with taurine, with phospholipids, and with additional optimization strategies as well. And finally, at the end of the podcast, we talked about John's real emphasis on mold, his own story of almost dying of a heart attack at the age of 33 related to mold illness. Really interesting and terrible, but he's doing obviously so much better now. And he has a whole mold course that's going to be coming out very soon as well. That is going to be available to those that are listening. So we'll have some additional stuff in the show notes about it. So John and I had a fantastic conversation. We covered a lot of ground in the time that we had together. And John obviously was just amazing at being able to throw it all out there, especially the nutrient and vitamin mineral deficiencies with all these medications. And we actually spent a lot of time on them, especially oral contraceptive pills, when we kind of dialed that in really, really significantly, which I really appreciated as well. So anyway, I really hope you enjoy this podcast with Dr. John Kim. If you like this podcast, don't forget to like and subscribe below, and enjoy. All right, Dr. John Kim, how are you, man?
Doing well, Dr. Scott. Appreciate you inviting me. I'm really been looking forward to this recording, so thank you so much.
It's been at least several years now since we've been hanging out and talking, mostly online and seeing each other at conferences. And I'm always impressed at your knowledge base. I mean, there's not that many pharmacists that are in the worlds of what you're doing in the functional space and medications. You have a mold course coming out soon. You did a full lecture at A4M on the cell danger response. Like, these are really cool things that not a lot of pharmacists are up to. And I love what you're up to. So thank you for being here, man. And I'm excited to rock through some different topics with you.
Yeah, looking forward to this.
Okay, so the first thing I wanted to talk about, which is, it's a big one. Every time we post something, I know that you post something on this, or we post something on this, or I do personally, about medications and nutrient deficiencies, it is very well there's a lot of interest here because people don't realize that so many common medications are causing vitamin, mineral, and nutrient deficiencies. So I thought we'd start off with, as a pharmacist, like the pharmacist's responsibility, one of the things that they're supposed to do, right? And doctors are supposed to do this too, but like pharmacists are like supposed to do this too, is tell their patients like what they're up to or what's going to happen when they take a certain medication, right?
Yeah.
And so give me the rundown here. Like we can go through any number of medications, but what are some of the main medications that you see that people don't realize are causing nutrient and other vitamin depletions, and that we need to know about these more?
Yeah, I think the biggest issue that we have to look at is that there are causation of mitochondrial dysfunction that occurs by taking medications. Now, I'm not saying that medication is bad. It's just that there's always a pros and cons of taking it. So my overall point of view as a pharmacist and as was working within the functional medicine space is that when you're taking medication, you have to know that there are risk and reward in taking it, number one. Number two, is there a long-term issue by taking these drugs because of something called drug-induced nutrition depletion? And third is there a way to combine with other nutraceuticals to enhance the effectiveness of the medication, because it is still a tool. If you're taking from medication to nutraceuticals or vitamins or supplements or herbs, there's still a toolbox for clinicians to utilize. But how can we combine all these things to enhance the effectiveness, number one, or can we take the natural approach to replacing your pharmaceuticals to give you the more benefit of that? And then number three is, can we get to the root cause of the issue so you don't have to be on medications?
That's a big deal, right? I mean, obviously we want to have our patients on as few medications as absolutely possible. Yeah. And the idea with the functional medicine space, of course, is to find that root cause, to figure out why you would need that medication and try to find natural ways, optimization ways to make everything, working without it. But in the cases where you do need medications, I like what you were just kind of describing there, which is sometimes a combination of pharmaceuticals and nutraceuticals together. Maybe that's a good way of kind of introducing some of the main medications that you would think about making that strategy a reality.
Yeah, absolutely. So one of the common drugs that are being prescribed in the United States is statin drugs.
Statins.
Right?
Yep,
Statins a big one. Statins end up having to deplete CoQ10. It actually affects vitamin K level, K2 level as well. And so when you're taking these particular drug, it actually affects the electron transport chain, which in itself causes leaking of the oxygen out of the mitochondria. As a result, the cells in itself becomes very inefficient. And you could see this, and there are studies showing that even athletes who are on statin drugs, their overall exercise capacity, right, that end up having to decrease because of that. Why? Because you're already reducing the potential of what that cell can do by giving statin drugs in itself. So statin, for instance, it is derived from mold toxins, which we'll discuss about more later on, but it's really interesting how some of these drugs are derived from mold toxins.
Red yeast rice, right?
Yes, it is.
Yeah. So are there better or worse statins in the sense of, like, talk about certain statins that are more lipophilic, the ones that can get across the blood-brain barrier, like atorvastatin, for example, or other ones that are not as easily get across the blood-brain barrier, like Crestor, for example, or rosuvastatin. Unless it's maybe like a fine point, but is there any difference that you see within the statin group as to what the severity of some of these symptoms might be with CoQ10 depletion, with vitamin K depletion, or is it hard to know one from the other?
So common symptom that can actually occur when you actually have a severe mitochondrial dysfunction, especially depletion of CoQ10, is rhabdomyolysis, where
of course,
if listeners are not aware, it's basically severe muscle damage that goes on, especially large group of muscle, especially the back or the thighs, and it's quite painful. So if you're already seeing symptoms of that nature, that's basically saying that almost 80% of your mitochondria is in a dysfunctional state.
Gotcha.
So really have to be careful with these things. So generally speaking, pravastatin tends to be less of an issue, right, compared to rosuvastatin or atorvastatin. So rosuvastatin is a brand name called Crestor. Right. Atorvastatin brand name is called Lipitor. So those two tends to be the most potent statin drugs available. And then you have the pravastatin portion of it, which generally is in a higher strength unit, but is more lipophilic as a result, as a lesser potential issue compared to those two others.
Got it. And so if you're looking at repletion of nutrients when somebody's on a statin drug. Are you also, so you're looking at vitamin K2, you're looking at CoQ10,
Yes.
Which you said, are you also looking at the steroid pathways at all, like your pregnenolone or DHEA or testosterone or anything like that typically? Or is
that's a very interesting question, because that's something that is not really talked about.
Yeah,
right? We always talk about CoQ10 being depleted, but never talking about if this actual steroids that you should be making, or at least cholesterol you should be making, to produce hormones.
Yes.
So this is the part that any patients who are going to be on statin drugs to really look at their hormone pathway, either doing salivary hormone testing or urine hormone testing, to see how much of a level of hormones are being broken down, or maybe it's being metabolized incorrectly. So couple of things, especially for men, I would recommend them to get their testosterone level checked, their total cholesterol level, not just look at the LDL, but entire breakdown of cholesterol. ApoB is a great number to look at, low density lipoprotein as well. And then when you're looking at DHA level, those are the really big things. And then lastly, what I would also look at is sex hormone binding globule on top of estradiol level in men, because when you have already a metabolic issue to begin with when you're taking statin drugs, well, your entire hormone pathway is not going to be metabolized correctly, because you're already having issue dealing with liver and not able to process the cholesterol correctly. So it's a bigger issue than anything.
Yeah. So I love to just kind of mention that, because not many people know about the CoQ10 issue. Actually, the vitamin K2 is pretty actually not as well known, but certainly the steroidogenesis pathways that statins prevent from happening are a big deal. So it's always important. I always recommend with my clients getting a full hormone panel, checking that regularly. So I appreciate you mentioning that as well. Okay, so what other drugs other than statins do you want to go to next?
The second portion will be PPIs, or acid-reducing drugs like H2 blockers.
The devils.
The devils, right? So some of the common drugs. And the most interesting part is that these drugs are over-the-counter now, right? So a lot of them, right? Mm-hmm. Pepsi, for instance, you have Nexium, you have those type of drugs, which end up having to reduce the stomach acid. Mm-hmm. But when you're looking at PPIs, the proton pump inhibitors, like Nexium, for instance, that is actually blocks the acid reduction permanently, right? So you have to have the separate proton pump being formed, and there's an entire turnover rate going on there. And the biggest issue that you see is that because you're reducing the stomach acid, now you're not able to absorb some of the nutrients that you need an acidic environment for, especially magnesium, iron, calcium, manganese, a lot of the minerals, right? B vitamins as well, vitamin D. Right, those are all affected. On top of now talking about nutrients, now you're talking about the microbiome, where when you end up having to increase the base, so the reducing the acidity end up having to cause the microbiome to be affected, and so there's a lot more growth of other harmful bacteria like E. coli, Clostridium, and you see this on the stool analysis. And the interesting part that I do is I'm a functional medicine provider, so I ready to look at stool analysis, and you could tell right away what type of gut issues are being formed while the patient's taking PPI, because now you're really affecting the acid level, which you really need to control some of the pathogens as well. Mm-hmm. Of course. Also overgrowth of yeast that could actually occur. And then on top of the fact that they're not able to absorb fat readily either. So again, fat now is affecting the cholesterol cascade. So the multiple issues. So I'm telling you, I've told clients whenever I actually see them, if you could prevent yourself from taking pharmaceutical drugs, that's the best way to do it.
Pardon the interruption. This episode is brought to you by Health Optimization Medicine and Practice Association, a nonprofit organization training practitioners how to optimize health rather than treat disease. For this episode, check out our chronobiology module. This is our module all based on circadian rhythms, optimizing them, assessing them, diagnosing them, and using vitamins, minerals, and nutrients and cofactors to see a significant difference. Check out the chronobiology module or any of our modules and save 10% by using code podcast10 at checkout. Now back to the show. Of course. Yeah. I mean, not always possible, but certainly when it comes to PPIs, these things are so overprescribed. And as you said, they're available over the counter. So people are like, oh, I can take it. It's over the counter. No big deal. Right. But then I didn't realize until you just mentioned this, that what a PPI does is actually sort of irreversibly destroy the actual proton pump itself.
Yep.
You have to make new ones. That's what you're just saying, right?
Yes. Yep. That's correct.
And that turnover process takes quite some time, I would imagine, after you stop a PPI.
Yep, that's correct. And as a result, when the patients try to get off of PPIs, it's very, very difficult.
Yeah, it can take a long time. And then with H2 blockers, like your Pepsids, your famotidine, et cetera, like, is it similar or is it not as significant as a PPI, right?
Not as significant, but when you're talking about Pepsid, they're very good for nighttime heartburn issues. So that generally is quicker acting and is short acting as well. So you could get off of it very readily. Now, in terms of nutrient being depleted, is very similar to the PPI. And so in terms of what you need to replace, I actually forgot to mention about CoQ10, but they're generally, you should get a very good multivitamin that actually covers all entity of that issue. But another thing that gets depleted a lot is zinc. And so when you have low zinc level, that also affects testosterone production in guys, right? When you have a low zinc level, you're not able to tolerate digesting protein as well, because now you're also reducing further levels of acid production. And this is a common cycle that I see of vegans, for instance, where they're not really eating red meat. As a result, they have low in zinc, low in B12. As a result, those two things are needed to make acid anyway, but now you're further reducing that capacity. So anytime you end up having to eat meat, for instance, they just cannot stomach it, number one, or number two, they have major indigestion because they just really destroy their gut from doing that.
Interesting. Yeah, I was talking to Nathan Bryant a while back, and I'm sure you know who he is. He's the nitric oxide guy.
Yes, sir.
And we were talking about PPIs and the ability to make nitric oxide go significantly down when you have less acid in your stomach as well, which obviously has lots of potential complications too.
Yeah, absolutely. So everything in the body is interconnected in the enzyme production, hormone production wise, your neurotransmitters as well. So that kind of goes nice way to talking about now SSRIs.
Okay, good.
Antidepressants. Right? Those things can actually is the third large drugs that patients end up having to take. And the biggest issue with taking antidepressants, for instance, like let's just take fluoxetine, for instance, like SSRI.
Sure.
Common drugs that people are taking. The issue with them is that end up having to cause depletion in B vitamins, and then it also affects the level of serotonin. Right.
Of course.
So because there's a poor feedback that goes on in terms of producing serotonin, because now you're preventing the reuptake. As a result, there is a major depletion of serotonin being produced. But also when you're depleting the absorption of B vitamins, especially B6, now you're not able to produce neurotransmitters correctly either. Right. The entire pathway, when you look at the entire neurotransmitter pathway, a lot of nutrients like magnesium, B6, and vitamin C are really the cofactors needed to making those nutrients. And some of these drugs especially end up having to affect that heavily as well.
Got it. Yeah. So B6 and magnesium, I know, are cofactors for the transition or the conversion of glutamate to GABA, for example. Just to give an example for people that are listening. When you talk about, this is interesting to me just to kind of dig into for a minute with the serotonin piece. So you're saying that because you have more serotonin around and as reuptake is inhibited,
yes,
you have a poor feedback loop. So you're having a feedback loop where you're actually making less serotonin.
Serotonin, right.
Okay. And then this is a downward sort of spiral where as a result of that, you're making less additional. What's happening as a result of that?
As a result of that, the patients end up having to have a plateau in their therapy. As a result, they may not be able to get the same effect of when they first started their SSRIs.
Got it. So they have to increase their dose.
Absolutely. And then another thing is that it also affects the microbiome as well. Right?
It does.
Because it actually prevents the production. It specifically actually affects bifidobacter level.
Okay.
And now you're not able to produce short-chain fatty acid well, which is butyrate. You need butyrate to absorb fat-soluble vitamins. That's number one. It helps to protect the DNA. Number three, actually acts as a chemical chaperone to prevent some of these toxins getting embedded to the cells. So there's a lot of roles in doing that, and also helps to renew the gut lining. The issue is that all these medications that have to affect some of these intricacies, and then when you're dealing with leaky gut, it's going to cause depression anyway, right? So what are you trying to fix except for just getting into this constant hamster wheel that you're not able to get out?
Yeah, well said. I mean, we know that, what is it, like 98% of our serotonin is made in the gut, something like that,
Yes,
right?
90% of it.
90% of it's made in the gut. So we know that that's a big deal. And you make a really great point about butyrate and bifidobacterium. And, butyrate's also the fuel of the large intestine as well. So if you don't have enough butyrate around, you can't make enough, you can't keep your gut without being leaky too. So that's going to be a problem. So
Absolutely.
it's all these feedback loops that we're messing around with here. And the other thing I was going to mention is that we now know very well that that depression is not a serotonin deficiency, right? So
It's not, all right? There was a study proving it, that it's not a chemical imbalance. There's a major underlying issue behind that's causing this problem. And it's usually nutrient deficient.
Exactly. Or you mentioned just recently, or just a minute ago, about leaky gut, right? That can also cause depression.
Causes depression as well as mitochondrial dysfunction already. And so, taking methylene blue, for instance, can be very helpful because now it's actually really increasing the redox pathway and ways that your electron transport chain is going to work well. So everything that's broken in terms of that Krebs cycle wheel is going to start turning.
I love it. Okay, we'll get back to methylene blue. I'm excited about it.
Yeah.
Because I know you've been playing around with it in a lot of different ways. But before we get there, are there any other medications that we want to kind of highlight here? We've talked about statins, PPIs, SSRIs.
I mean, there's non-ending issue with taking oral contraceptives as well. So oral contraceptives, for instance, actually decreases zinc level, B vitamins. It also decreases CoQ10, magnesium, vitamin D, manganese. It also affects your gut microbiome as well. So what they found is that when you're taking birth control pills, for instance, the level of having vaginal issues as well as UTI levels end up having to increase because you're now affecting the positive microbiome matters that needs to be established within those tissues.
Mm-hmm. Okay.
So you have a higher risk factor of actually contracting viral infections like herpes, as well as fungal like vaginal yeast infections or bacterial vaginitis. So those end up having to increase. There's studies looking at female athletes. Their exercise capacity level end up having to decrease taking birth control pills because now it's affecting the micronutrients, but now it's causing mitochondrial dysfunction by taking these things.
Yeah.
Right? So it let capacity end up having to decrease heavily on these female young athletes.
Interesting. Do we know if there's more, are there oral contraceptives that are worse versus ones that are less bad in the sense of IUDs that are copper IUDs compared to, and that's not really oral contraceptive, that's an IUD. Never mind. But ones that oral, Scott, oral. Okay. Anyway, when it comes to, do we have a sense of what's better or worse? It's or it's all kind of flavors of the same flavor of ice cream kind of thing.
These are more interrelated to conjugated estrogens. So ethinyl estradiol, for instance. But when you're looking at the synthetic progestin, right, there's a difference between progesterone and progestin. Right. And this is the part that I get really upset about, especially when you're talking about the negative impact of hormones. And in the news especially, they're like, progesterone and progestin is the same. I'm like, no, that's not. It's completely different.
Right.
It sends different messages in the body, and it shows a different side effect profile. On top, progestin, the synthetic progesterone, stays in the body longer, which can actually affect vasculature, as well as you have a high risk of having blood clot, right? So these are common things that can be seen. I mean, I had a friend who actually had a brain aneurysm taking synthetic progestin because she already had a risk factor being obese. And then secondly, she also had history of smoking. Right. So these are all black box warnings to begin with, but we don't readily talk to them, especially younger females and parents who are making this decision for their kids, to really think about whether taking birth control pills at such a tender young age of, let's just say 11, 12 years old, does that make sense? And as well as when we talk about the consequences of mitochondrial dysfunction, nutrient depletion that you end up having to cause, microbiome issues, and then other issues, especially the levels of hypothyroid issues are now interlinked to using birth control pills. And so your level of risk factor of developing hypothyroidism actually goes up by almost 200% because taking birth control pills at the young age.
Wow. And that's probably from nutrient deficiency or nutrient depletion?
Absolutely. That, and then also you're affecting the gut microbiome and the neurotransmitters. We also have to talk about how serotonin level gets decreased because of birth control pills. So now you're taking birth control pills. Now your level of serotonin have decrease. You feel depressed. The next step is what? Taking antidepressants. Right. So what are you fixing at this point? You're just going in a cycle of issue of medication after medication. So as a pharmacist, knowing this, am I doing a better service for my patients when I'm actually seeing them taking this constantly, especially young patients?
That's crazy. I mean, when you talked about like the progestin, the synthetic estrogens, et cetera, when you're looking at patients that are on hormone replacement therapy, but they're on like natural things, like, natural sources or bioidenticals, we would call it, from estrogen, progesterone, testosterone. Do you see the same kinds of issues, or is this really more related to the synthetic progestins and estrogens that we're using in birth control pills?
So a lot more with synthetic hormones. However, when you're taking any form of estrogen, for instance, it can still deplete those nutrients, especially B vitamins. So I do recommend doing that. Another thing is that when you're taking oral contraceptives, it also increases sex hormone binding globule.
Right.
So now your free testosterone level decrease. So what's the common symptoms that female patients say when they're taking birth control pills? The libido goes down. Right. And then the metabolism definitely go down as well. So weight gain, it can be an issue.
Right. Yeah. I remember reading a study recently, maybe in the last couple of years, about you might be attracted to the wrong kind of partner for you while you're on a birth control pill. And then like you come off the birth control pill and you don't have any interest in your partner at all.
I know. It's crazy. So, the interesting part that I've seen in a study, back in 2013, there was a study that stated oral contraceptives and change in nutritional requirement. And it was a European study.
Okay.
But that particular article was adapted by the World Health Organization as well. So they already saw that these are potential medications that's going to cause heavy amounts of issue, causing nutrition depletion. But the problem is that ACOG, for instance, do not recognize this and don't readily talk about this at all. And then when you are seeing patients who are not well, they're being completely gaslighted, and they're trying to change the different oral contraceptives or other forms of contraceptives that are not really doing any justice. Like, let's go to the copper IUD, for instance. I mean, the major impact of copper IUD is that it does affect your vaginal microbiome now, right? So you have high levels of causing yeast infections or chronic vaginitis problem as well. Intercystitis can actually occur. Their mucosal tissue, underlying mucosal tissue gets affected. So there's a lot of problem right now. So there's entire movement of females, especially now, knowing this, right? They're going more on the natural side of really timing their cycle, as well as really being mindful about and being more planning aspect of it when they're actually engaging in sexual intercourse. I think that's really empowering, because now they have the ways and knowing that you don't have to be on birth control pills. And there are tools available, especially oral ring, for instance, or other wearable devices that really times your luteal phase. And you know that you need to be careful in those times. And that is a lot more natural and respect the body as well, respecting Mother Nature. And the overall femininity of how hormones should be respected.
Like all hormones, right? For sure. It's a really interesting topic. Are there any other medications that you want to talk about? I was in my brain, I was thinking about Tylenol right now, and what if we wanted to chat about that one, because I think that's an important one, because again, that's over the counter. You can take, do not do this, but you can take 50 or 100 Tylenol tomorrow, and you could die from liver failure without anybody ever knowing in that case. What are some major deficiencies and issues that we see with Tylenol?
So Tylenol, or acetaminophen, is a common drug that's being utilized. It actually affects the COX-3 pathway, which are now being utilized even more. The interesting part is that it actually depletes glutathione level in the body, right? So it causes more oxidative stress. So when you are already having a patient who actually has a high fever to begin with, and then you need glutathione to help affecting positive changes in the immune system, and as well as working through the process of clearing up viruses and such, you're now preventing the body to do its own job by giving acetaminophen, right? So I'm not saying that taking ibuprofen or any NSAIDs any better, but taking acetaminophen is not a good choice to do so, right? I mean, if you have a headache, for instance, taking acetaminophen, randomly, is that going to affect it? No. But when you see, especially elderly patients going to a pharmacy, especially when you go to Costco, they sell a 500 count bottles of acetaminophen.
It's crazy.
Why do you need that much tablets?
Pardon the interruption. This episode is brought to you by Transcriptions, makers of precision-dosed, physician-formulated, and pharmaceutical-grade formulas in the form of a buccal turkey. This episode, check out our Just Blue. Just Blue is pure pharmaceutical-grade methylene blue, 16 milligrams to optimize your energy production, your detoxification, and if you're really getting interesting and getting a little fancy, try it with LDN, CoQ10, phosphatidylcholine, and with more. This is what John talks about during the episode. So go to transcriptions.com and save 10% on your order by using code POD10 at checkout. Now back to the show. Well, everything at Costco has got to be bigger and better, or at least more of whatever it is. But yeah, I mean, so definitely glutathione depletion is well known. And as we get older, as most of us know, like you have less glutathione in stores, but especially if you're also doing other things to deplete your glutathione, like drinking alcohol on a regular basis, right?
Absolutely. And then when you're chronically inflamed to begin with, now your levels of glutathione even gets depleted even more. Right. So that's something that you have to really look at. And as well as acetaminophen is hepatotoxic.
Yes.
All right. So that's something that we really have to discuss about, that these over-the-counter drugs, although it's considered to be quote unquote safe, it's really not safe if you're using it for a long period of time. I mean, I'll give you a perfect example. PPIs, like we talked about it earlier, PPIs, when you look at the back of the box, it tells you to use no more than 14 days.
Right.
But then what's happening right now? Everybody's using, people who are on this, they use it every single day. And the doctors say, yeah, you could use it every day. So it's a problem.
You're totally right. I mean, like I've been enough in the hospital to know that if you have a bleeding ulcer, if you have like an upper GI bleed because of, gastritis that's pretty severe, yes, you will need a PPI for a period of time so that you can calm things down, heal the ulcer, heal the gastritis, and then you should be off of it. The only population of people that I think are more challenging are the people with something called Barrett's esophagus, which right? The Barrett's, because these guys have early signs of dysplasia or like aspects of their esophagus that show like signs of early stage of cancer or like precancerous stuff. Like that's a bit of a trickier conversation, but in essence, for the most part, people should be off PPIs as soon as they possibly can. So.
Yeah, absolutely. No, this is true. And especially when I was working at the ICU unit for ICU patients, when you see them, and there are studies showing this, that ICU patients, they have a high risk of actually having stomach bleed, right? That's where it should be applied to. But then when I saw, this is the part that I laugh about it, some of the younger medical residents, they get on rounds, they put everybody on PPI. Everybody. Okay. You don't need to put a regular floor patients on a PPI, but let's just put everybody on PPI.
Yeah. I mean, if we could do it for one person, do it for everybody. And then, the problem is once you get it on the medication, when you're in the hospital, it stays on your medication list when you get discharged. Yeah. And then nobody knows about it. And then like 6 months later, you're demented because you've been taking, it'll take one.
It's not so that, I know. But it's just the part that like, it drives me nuts. And this is the part where clinical pharmacists and a medical round team end up having to review the medications and then really ask thoughtful questions like, I understand that you're prescribing, but do you really need it? Like, do you really need to put the patients on this? I mean, I had a client at one time, funny story, a bunch of ICU patients were agitated. So this medical residents decided to put everybody on a Haldol overnight.
Vitamin H.
Oh my goodness. And he was in deep trouble after that, but it's crazy.
He wanted a quiet night, it sounds like.
Exactly.
Oh, I can relate, but I don't think I've ever done that. I know I haven't, but I can relate. Interesting. So, any more medications you want to go through at all? I mean,
antibiotic is a huge.
Okay, so let's talk about it.
Right? So, antibiotic, for instance, I mean, not only know how to affect the gut microbiome, but the biggest challenge that we see with antibiotic is that some of these more advanced antibiotics end up having to cause issue behind mitochondrial dysfunction further, right? Mm-hmm. So, I did a post just recently talk about Fluxed. So it's fluoroquinolone toxicity.
Yep.
Mm-hmm. Right. So these are common, not common, but it can actually occur randomly But the issue is that when you're combining fluoroquinolones, which contains fluoride, and other fluoride-containing drugs like Lipitor, rosuvastatin, statin drugs especially, steroids.
Wait, the statins contain fluoride?
When you look at the molecule, it actually has fluoride.
Really?
Yeah.
I didn't know that. Okay.
Yeah.
Okay.
When you, right after this, go on Google and then check the molecule of rosuvastatin.
I will.
Right in the middle of that ring, statin, the cholesterol ring, actually looks like a cholesterol ring to begin with. It actually has a fluoride group right onto that.
Interesting. So you're saying the combination of the fluoride from the fluoroquinolones alongside some of these other fluorinated molecules is interacting in a negative way.
Correct. And so what happened? So let's discuss about fluoroquinolone toxicity. So the studies showing like ciprofloxacin, for instance, actually shows that it can cause major mitochondrial genome change. What does that mean? It actually damages the mitochondrial DNA, right? So that's another thing that we forget to mention, that there is the DNA and then the mitochondrial DNA. And when you affect the mitochondrial DNA, now you're actually affecting permanent change and affecting damages in the cell in itself. Right. So that's another thing that could potentially impair mitochondrial energy production. And then when you're adding in the flux being flux, so that's fluoroquinolone toxicity, that's basically a potentially a serious and a long-term or permanently disabling side effects for patients. So I mentioned about how when you are having symptoms because of medication, that means that there's some type of major change or damage that goes on. So specifically for these patients, they have 70% or more of a mitochondrial damage resulted in cardiovascular issues, CNS damage, musculoskeletal problems, leading into damage in the cell membrane, mitochondrial dysfunction I mentioned about, cardiotoxicity, arrhythmia, brain fog, peripheral neuropathy.
That's a big one I've seen. It's a peripheral neuropathy. Like I've seen tons of people with the flux, this kind of syndrome that always like peripheral neuropathy is like, it's like terrible. It's so debilitating for somebody.
Yeah, it is. And they can't even walk well. Tendonitis issues, another thing. Of course. Muscle atrophy, tremors, joint pain, and then also actually increased reflexes. So how do you predict whether these patients are going to be having this potential issue? When you're adding in, I mentioned about some drug combinations. So fluoroquinolones with ibuprofen, for instance, because ibuprofen also contains fluoride, right?
I didn't know that either. Okay, interesting.
Fluoroquinolones with steroids, or there's the worst combination, I think, fluoroquinolones with ibuprofen and steroid plus antidepressants.
Wow. Okay. So this is just a very common combination to cause nastiness.
Nastiness, huge. And then when you have an underlying issue such as Lyme disease, right? Or I think many cases, these patients already have some type of glyphosate toxicity, and glyphosates end up having to replace glycine out of the tendon or the tissues. As a result, your tendons and the tissues or ligaments are already brittle. Okay. Right? So you have a high propensity of actually having an injury. And then the third could be genetic variations like MTHFR issues or GST, or your VDR aspect of it is already messed up. So there's a lot of drugs that you need to stay away from. Any type of topical, including oral steroids, right? SSRIs you need to stay away from.
Sorry, go ahead. I was going to ask about steroids. So you mean like all across steroids? Are you talking about like if you need steroids, like if you have an acute inflammatory reaction, acute infection, sometimes it can be very helpful. Like there's probably better steroids and less better, or less good. But they're all going to deplete and potentially cause an issue, especially if you're on antibiotics at the same time, is what you mean, right?
Not that. It's just that if you already have had injury from being fluxed, then you need to. Let me clarify that. For patients who's been fluxed, they need to stay away from these particular drugs. So but the risk factor of being fluxed also increases with the combination of drugs that I mentioned about.
So, because you were talking about being fluxed in this period, but we clarified. So, but the worst combination you said was like a fluoroquinolone, a statin, an NSAID, and like oral contraceptives and SSRIs, like anything like those are all bad when it comes to being on like in combination is really what it sounds like.
Yeah, that's it. And then steroids wise, you're looking at clobetasol, fluticasone, right? So those are fluorinated steroids.
Yeah.
And
Okay.
then NSAIDs like naproxen, ibuprofen, celecoxib, right?
Yeah.
Meloxicam, those are all contain fluoride.
Okay.
SSRIs I mentioned about like paroxetine, right? Citalopram, fluoxetine, right? There's already a fluoride group already there.
Okay.
Statin drugs I mentioned about rosuvastatin, atorvastatin, all PPIs.
All PPIs. Okay.
Contains fluoride. Fluconazole already has fluoride in it.
Man, this fluoride stuff you're making me realize it's like in every single drug. I didn't realize.
They are, right? And we don't even think about this.
Wow. And we think of that as like sort of a mitochondrial toxin in this case, right? And that's really what, okay. Very interesting. Well, this has been enlightening, man. I didn't actually really know a lot about this fluoride aspect of things and the combination causing so many issues. I've definitely in my clinical practice seen a lot of unfortunate people that have had a fluoroquinolone toxicity, but I didn't realize it was likely because of the synergy occurring as a result of, having some of these other drugs on board. So thank you for that.
Absolutely.
When it comes to any final, there's like so many other categories and drugs. We'll go for one more that's important, maybe that we should go over. Any more that you can think of?
Oh, let's talk about some older antibiotics. For instance, when you're talking about like penicillin, as well as talking about cephalosporins, they end up having to deplete magnesium. They also deplete vitamin K, because obviously vitamin K pathways all depending on the microbiome, right?
Sure. Yeah.
Calcium, B3, B5, and then CoQ10 along with zinc. So these are the really effects that the most interesting part is that anytime, and this is studies being seen, is that anytime you're going to be on any antibiotic, does not make a difference whether it's an old or new one, by just taking 4 days of antibiotic alone, it actually wipes out your gut microbiome. It actually takes about 2 to 4 years for natural flora to come back. Many reasons why you should be on a probiotic if you're going to be taking any antibiotic. And one of the key things I mentioned to my patients that you need to stay away from probiotic for at least 4 hours after taking antibiotic. Then take a probiotic to supplement that in.
Right. So it's a 4 hour, you recommend a 4 hour break. So you take your antibiotics, then 4 hours later, you take your probiotic, and then you take your antibiotic, and then 4 hours later, if you have it twice a day or something like that.
Correct.
Yeah. That's common. And I usually have people on for a longer period of time, obviously after they finish their antibiotics as well. I'm sure you do as well.
Yeah, absolutely.
Yeah. Oh, that's a great list, man. One thing you mentioned there that I wanted to just ask you a quick question was on the glyphosate. So you mentioned glyphosate briefly, and you talked about it sort of taking the place of glycine. Can you just kind of talk about that a little bit more? Maybe glyphosate a little bit more, because it sounds like you have a little bit more interest and knowledge about this and how that can potentially, we know it affects the microbiome and other things, and maybe kind of go over. Yeah.
So glyphosate is a pesticides that are in Roundups, right? So there's been interlink of glyphosate affecting not only the microbiome or any type of microbiome, because it affects that, but secondarily actually is a neurotoxin, right? Number one. It also causes mitochondrial dysfunction because actually it blocks the electron transport chain, as well as impairing the phospholipids production, and as well as producing ATP. So there's a lot of issues there, but also affecting the mitochondrial DNA. And so this actually can cause a lack of autophagy, which resulting in cancer, which can actually occur there. But one of the interesting part of finding is that glyphosate actually has a high propensity to attach to a glycine within the amino acid. As a result, you need glycine to help producing collagen. Right. So when you have a deficiency of this, you have a likely chance or more likely chance of actually having some type of injury because of that reason. So this is a part that I always say is like, is it when you're having this type of injuries, and you see this commonly in athletes, is it because of overcompensation, or is it that they already have a ongoing issue with toxicity that you're not really looking at? And it would be interesting if functional medicine could be combined within the athletic world to really help to enhance the athletic capacity and lack of injury and prevention that we could do for athletes by looking at total toxin levels in the body.
Yeah, this is huge. And I appreciate you mentioning it. I hadn't thought about it in the sense of, I had known about this, but I hadn't really thought about it in detail related to the glycine transposition there and causing more collagen issues as a result of that, and collagen destruction that might be easier with something like a fluoroquinolone, as you described it before. So More fluoride. Man, I'm going to have to be looking at this more. This is very interesting to me.
Fluoride is one. And I, whenever I should do any type of consults, I get a full list of medications and the supplements, and then where they also live. Because if you end up having to live near a golf course, for instance,
yes,
right, when you get out of your house, all that whiff of that glyphosate coming at you.
Yeah, it's crazy around there, man. I mean, it's all the chemicals they use on those things. It's absolutely insane, right?
Oh yeah, it is. It is actually, when you go to golf course, for instance, they actually have a warning sign that this field is sprayed with pesticides.
Yeah. It's insane. But all these older people want to live next to the golf course, right? And I mean, that was a good tour de force, man. I appreciate it. I wanted to get your opinions on how you're using methylene blue, because you, as a pharmacist, you've been doing much more than many people here, and we've discussed some of this. But I'd love to chat about methylene blue and some of the things you're working on with like taurine, phospholipids, LDN, a little bit of that, and what you're seeing in clinical practice as a result of combining.
Yeah, absolutely. So let me share my experience into using methylene blue.
Yeah.
So last year, as you know, that I had my Achilles injury. So I had a very unfortunate accident. I was helping a customer out, pushing his car for him because it was stalled. Unfortunately, that car ended up rolling back at me.
Oh, okay.
And then I took the brunt of that weight and the force, and it ruptured my right Achilles. So, multiple other things we tried. And then when I did the MRI, my Achilles was actually retracting back. As a result, I ended up having to go for a surgery. So after surgery, I ended up taking took 2 of the 25 milligram methylene blue that I actually ended up compounding it. So that was a capsule that I did. And that's a part that really helped out into reducing pain, which was profound. I never experienced it. I heard about it, but just to try that was really profound. So that's been really helpful. But when you're looking at the entirety of the healing cycle and looking at how methylene blue can be helpful for mitochondrial function and allowing proper tissue remodeling, and as well as increasing nitric oxide, right, is very helpful for recovery after surgery. So that's the part that I start utilizing and been recommending it for patients as well. But for purpose of my aspect of it, I end up having to use methylene blue for patients dealing with mold toxicity generally, and as well as some type of long COVID issues as well. So we're recommending prescription, and then there's some patients who are needing higher doses, like 300 milligrams of methylene blue, that we end up having to compound.
For sure.
So this are avenues that we end up having to work together. When you combine these things, especially low-dose naltrexone, phospholipids that I use a lot on, and then when you're combining methylene blue on top of taurine, which we could talk about later, but those are really powerhouses that, as a nutrition aspect to support long COVID patients, that's been really helpful for them.
So why do you think the phospholipids are so helpful when you're using it in combination with methylene blue?
Yeah. So phospholipids, for instance, if people are not aware, when you're looking at the cell membrane structure, it's a bilayeral structure. So top layer is actually comprised of phospholipids, and the other bottom layer, or the inner part of the cell membrane, is comprised of linoleic acid and alpha linoleic. So when you're looking at the role of the phospholipids, which comprise of 4 phospholipids, which is phosphocholine, phosphorethanolamine, phosphonopsitol, and phosphoserine, these end up having to be a building block on the outer portion of the cell membrane, which is an essential component for the cell membrane structure. And when you have a mitochondrial dysfunction, you basically have to understand that there's a cell membrane structural issue. As a result, you need a proper intake as with supplementation of the phospholipids to help repair and maintain the fluidity and the functionality of the membrane, which caused by the toxin. Specifically in this scenario is the spike protein, and then the oxidative stress and the inflammation. And also replacing that lipid bilayer structure is crucial for protecting the cell and maintaining it. Now, how does it end up having to help support the mitochondria, and how does it end up having to combine with methylene blue, is that when you're looking at to enhancing the mitochondrial function, for instance, methylene blue supports the electron transport chain, while phospholipids repair the mitochondrial membrane, and creating a synergistic effect to boost the ATP production and reducing oxidative stress. So it's actually one, two. You need the lipids to support the cell membrane for the electron transport chain to work properly. So that's the part there. That's the part where I always mention about, it's about your cell membrane for your receptors to work well, right? In order for your electron transport to work well, you need to have a healthy cell membrane. So this is the part that I actually combine together. Secondly, cellular resiliency and detoxing as well. So phospholipids restore cellular barrier and aids in the methylene blue's penetration to cells for the mitochondrial support, followed by, when you put it together, it actually enhances the removal of toxins and support overall cell health. And then reducing inflammation, right? That's another big part where methylene blue reduces inflammation through antioxidant action, while phospholipids rebuilds the damaged membranes and reducing cellular signal, perpetuating inflammation that's going on. And then it's also neuroprotective and cognitive health as well, where methylene blue supports the mitochondrial support in neurons, is enhanced by the phospholipid bilayer structure and the role. And this is really helpful for neural membrane integrity and fluidity. So this is where the application kind of comes in into combining all these two together.
I love it. Yeah. I mean, one of the things that Dr. Ted, who's the founder of Home Hope, as you know, in transcriptions, likes to ask the question always to our students in our courses is what is the brain of our brain? Sorry, brain of our cell, excuse me. Brain of our cell. Brain of our brain. That's interesting. But a brain of our cell. And so most people will say that the nucleus is your brain. But actually, no, it's not the nucleus. It's actually your cell membrane, because your cell membrane is what's actually giving you the sense of what's actually happening and always converting with the outside environment, right? To give you a sense of what's actually happening. So the brain really is your cell membrane. And so, and people also forget that our mitochondria and all of our organelles also have cell membranes as well, that they need to be minded. So I think that's really interesting. And you also mentioned LDN. So you're using mostly the LDN on for like the inflammatory aspects of things as well, right?
Well, low-dose naltrexone is a very interesting application because of the fact that LDN, it's a opiate blocker, right? If people don't know what naltrexone is, naltrexone has been utilized in opiate withdrawal, but also for alcohol withdrawal issues. And the strength is around like 50 to 100 milligrams the patient might be taking. But when you talk about low-dose naltrexone, the dosing is around 0.5 to 4.5. In certain cases, for severe chronic autoimmune disease, you end up having to go close to around 16 milligrams a day, right? So why is it that low-dose naltrexone can actually be helpful is because naltrexone in general actually has an immunomodulatory effect.
Right.
So LDN works as a transient opiate blocker, leading into upregulating endorphins, and especially acting as a natural opiate has a profound effect on the immunoregulatory effect, reducing inflammation as well as modulating the immune system. So there's a huge part where it can be added on top of reducing chronic inflammation and as well as a mitochondrial support. How? By reducing the inflammation,
right.
LDN actually indirectly supports the mitochondrial function, as a chronic inflammation can impair mitochondrial dynamic and energy production. So when you're adding in methylene blue, for instance, actually acts synergistically as an anti-inflammatory synergy, because LDN actually reduces cytokine production, and then methylene blue supports and protects the mitochondria from inflammatory damages and reducing reactive oxygen species. Another thing that I love how LDN methylene blue adds in together is by supporting chronic fatigue and pain syndrome as well, because LDN actually helps to regulate the pain receptor and the overactivity of the immune response that's actually happening. And then methylene blue helps to support the energy metabolism while addressing mitochondrial dysfunction, followed by neuroinflammation. Again, the brain, neuroinflammation and brain health. LDN helps to reduce microglial activation, calming the neuroinflammation, while methylene blue enhances the neural energy production and reduces oxidative stress and improving cognitive ability. And then immune and cellular repair is another big one, where LDN helps to promote tissue repair and immune system balancing, while methylene blue helps to facilitate mitochondrial repair and cellular energy production. And the last part is the improvement of autoimmune symptoms that the patient might be dealing with.
That's a well described overview, man. Thank you. And what about the taurine piece? How are you thinking about the taurine in this?
So the way that the taurine and to work is to help with energy production, but also helps to mend the cell membrane and then the energy potential that it actually has. So not only taurine actually helps to act to calm the neuroinflammation down, but it actually helps to enhance the activity of the methylene blue by enhancing that property. So it's really synergistic effect. Why I think I mentioned to you on the on our text, I usually recommend around 500 milligrams of taurine with around like 5 to 10 milligrams of methylene blue if they're going to be on it.
I love it. I love it. It's a fantastic overview. And so with all of that, I know one of the main ways you use methylene blue is around mold. And I know you have an expertise in this, and it's much more than using methylene blue for mold. You're going to have a course coming out with this as well. So I don't want to spend a lot of time, as I know you have a whole course on this, but I wanted to give an overview for those that are listening. How do you think about diagnosis and treatment, and like what's your framework here overall? Because I know that very likely you have a very sort of high level overview. We can dig into some details here, but thought we could start off with just mold in the framework that you use as a way of like diagnosis and treatment at this point.
Yeah, absolutely. I mean, the reason that I got into mold topic was because I actually had a heart attack when I was 33 years old.
Yeah,
from mold toxicity. So it's a story that I always share, is because that was a profound moment where it really put me, actually humbled me severely to think about, oh my God, I'm not really living a healthy life. And secondly, I already had an existing issue that was hidden that I was not aware of. And then asking a lot of questions is, how can a 33-year-old having 85% blockage in my LAD,
it's crazy,
and I ended up having to have a stent put in? So that was a major aha moment of looking at and asking a lot of questions and getting to the root cause. And that mitochondrial dysfunction I was dealing with is caused by the mold toxicity. On top of, I had Bartonella infection, Epstein-Barr, heavy metal. I mean, I used to play around with liquid mercury all the time with my hand. I mean, it was a common thing that I would take a mercury thermometer, shatter it, and then play around with mercury.
What? When did you do this?
When I was a kid, of course.
Wow, that's crazy.
I mean, I still remember my grandmother used to give me these liquid mercurium to act as a antiseptic on my cut. Do you remember those back in the day?
No, I don't know about those. Yeah.
Okay, so those are antiseptics that contains mercury in it. So it actually has it looks like a red dye because obviously oxidized. And it comes in a little glass bottle.
Okay.
Johnson & Johnson used to make this.
Of course.
So So when I was living in Korea, anytime I had a cut, my grandmother used to take this particular bottle and then wipe that antiseptic on my skin. But yeah, that was where a lot of that probably mercury and exposure that came from.
Sure.
And then, living in a very moldy environment, growing up in a high school. And then this is a major part that I mentioned about in my cell danger response, is that I had a lot of childhood trauma, and I didn't realize how much of that causes activation in my brain and constant neuroinflammation, also leading into leaky gut. And then when you have mold issue, it just becomes a perfect scenario for chronic inflammatory state to come in, but you don't realize how inflamed you are until something happening. And something happening was a heart attack for me.
Yeah, that's crazy.
Right.
Yeah.
So the way that I actually approach patient, I don't particularly feel that mold is the major critical thing that's going to be affecting everybody, but it is a part of component that we have to look at. The reason being is, in terms of where you live, where you get exposed to and such, there is some type of mold toxins or so-called mycotoxin being involved that you get exposed to. And over time, right, it's either you get larger exposure in a short period of time or small bits of the mold exposure period of time, leading into your immune system being in a dysfunctional state. Right. So mold toxins, for instance, I'll give you a perfect example. There's a drug called cyclosporin, as well as mycophenolate. Those are anti-rejection drugs derived from mold toxins. Right. Statin drugs I mentioned about are derived from mold. Right. So we already utilize and know that these are very powerful components into modulating the immune system, as well as affecting some of the enzyme production as well, including cholesterol. Well, when you end up having to deal with some of these mold toxins, it not only causing immunosuppression, but also causes mitochondrial dysfunction, cell membrane damage, increasing reactive oxygen species, followed by affecting the liver and the bile production, microbiome changes, neural inflammation, and then as well as chronic inflammatory state that's been constantly turned on, that in many cases that is becoming almost like a gateway for other issues that come through, for instance, like Lyme disease. And so when you're looking at mold, not only are you looking at mold, there's other co-infections that come through that could heavily impact that person's health. So it's a very hard issue that you have to look at, but it's almost like a peel and an onion, right? There's a layer of layers of issues. And then the most difficult part is these patients over the years may end up having to develop something called mast cell activation issues, where MCAS, where every little aspect is actually causing them to react.
Yeah.
So for them to live a very peaceful life is very heavily affected. Everything from food to chemicals to scent, any type of stress response, it can really trigger them to having symptoms that it can't function correctly. So mold can be a big component, but it's not the major component that we're going to be just heavily focusing on. But why am I doing this particular course is that at least I'm able to teach my followers, and I have a couple of clinicians who can be on it as well, to really let them know that mold can be one of the hidden culprit issues that you're not really looking at, that really need to dive in and really ask the right questions. And how do we reverse positive changes from this aspect of it? So major focus is be on what is mold, how to find and what to do in terms of testing for mold at home, but as well as proper testing for your body. So usually I recommend urine mycotoxin testing. So Real-Time Labs or Vibrant Wellness. Those are two lab companies that I utilize. And then a major component is a cell danger response. Why is that? It's because when you have an underlying issue dealing with the environment being affecting you, as well as nervous system dysfunction, mitochondrial issues, followed by microbiome changes because of mold, parasites, bacteria, and viruses. These are all underlying issues which end up having to cause your mitochondria in a cell danger response state that it is very difficult for the body to calm and allowing proper healing to occur. And so if you look at Dr. Robert Navio's work talking about the healing cycle as well as the chronic inflammatory issues the patient dealing with, and then improper healing leading into a cellular and epigenetic changes leading into chronic state of disease states like autoimmune or chronic pain disorder, psychosis, which can lead into that as well. So this is the part that where patients are dealing with multiple co-infections, especially for mold. You have a chronic inflammatory state, which is resulting in all these epigenetic changes. Now you have some of the underlying disease states that you're not able to understand why you have those.
It's really well said. I think the cell danger response is such a big piece for what you're describing and how the system goes into what we call either summer or winter metabolism. You know, the things you're in like full hibernation mode and you're holding on to weight and you don't know why, and you feel like terrible because the body's just trying to protect itself, and you can't get out of this process without addressing some of the underlying reasons as to why you're there, right? And that's really what you're talking about. And I also appreciate that you're putting mold in context, because I think that there is a school of thought that everybody has mold and that needs to be treated, where you're saying that, no, it could be a smaller piece of the puzzle, but it can still be a piece that needs to be addressed. I mean, I'm sure you've seen a lot of people like I have over the last several years with reactivations of things like mold and EBV and Lyme disease and things like that. And the major issue is not so much those, but it's the immune system dysfunction and the cell danger response that's causing the major issue, and that needs to be addressed primarily, right?
Yeah, absolutely. And so you got to unravel this process very, very slowly. And major thing is that clients have to understand that you're not going to be able to see the results right away.
Right.
That there are levels of issues. A hierarchical issue that we need to really address is, how do we calm your nervous system dysfunction, right?
Right.
How do we calm your overall circadian rhythm issues that you've been dealing with? And then so another component that I actually add on to now more and more is that if the patients are actually having these type of reactions and then sensitivity issues, the first thing I mention to them is you need to control your light. right?
Mm.
What kind of light are you getting exposed to? So
Sure.
sometimes I tell clients that you need to be away from artificial blue light for at least 2 to 3 hours. So you need to be in almost complete darkness, utilizing red light, right? Small red light, and also control the amount of lux they're getting exposed to, or at least the intensity of the light itself.
Right. Yeah.
Right? Because that also can actually trigger a lot of nervous system dysfunction as well.
Yeah. Autonomic dysfunction. Yep.
Yeah, absolutely. So everything from your LED screen, your phone, including your EMF, end up having to cause major issues around that area, and they are finding that, including like EMF exposure, right? That can lead into glucose dysfunction as well, right? So these are things that we end up having to utilize as a wearable device, like Oura Ring or even continuous glucose monitors. How much of that are we not looking at if these are potentially causing additional mitochondrial damages we're trying to fix? So it's really been an eye-opening moment for me and able to teach. So I'm really humbled and honored that I was able to work with these different clients and looking at this and able to give them a better insight so that, yes, proper healing is possible as long as we're looking at the four spectrum that I mentioned before. The environment is a big factor, where if you grew up in a very stressful environment or abusive environment, including a environment that was not feeling safe. So you have to live in a moldy environment, for instance, right? There's some kind of environmental toxins you're getting exposed to, right? When you have a poor light mechanism that you're constantly getting exposed to, those are all stimulating. And when you have a chronic state of that stimulation, now you're leading into nervous system dysfunction. So the second part I want to teach clients, how do we regulate your nervous system to calm itself down, right? Because the chronic inflammatory state also leads into nervous system dysfunction because you're constantly turning on that microglia. So that neuroinflammation, the executive function that you're trying to have, you cannot happen to fix that issue. So everything that methylene blue and low-dose naltrexone is trying to affect and positive changes there, well, how do we allow even deeper aspect of it, so this way we build resiliency within those clients to handle their environment and the nervous system better? Now the next part that I go into is the microbiome changes, where mold is a component, right? Virus is a big component, and as well as a bacterial overload, right, in the gut, as well as probably chronic infections, and then as well as leading into issues like parasites, right? That's another hidden site that we modern, at least allopathic medicine in the Western world, we don't really look at. So that has to be also talked about. And then the other aspect is going to be, how do we reverse cell membrane or cellular changes that goes on to properly allow autophagy to occur, right? So when you're doing all these things, including methylene blue, phospholipids, and such, at one point you're allowing proper autophagy to occur. Why? You need to have a better cell turnover rate, because so this way your body's able to turn over and then able to fix itself. So I'm a big component, a big believer that as long as you give the right tools, the body's able to heal itself. And that's something that everybody can achieve.
That's awesome. I'm really excited for that, man. I think it sounds like very holistic, very comprehensive, and I'm excited for it. So I have one more question for you, John, before we finish up.
Yeah.
It's a question we ask everybody at the end of our podcast, and then we'll get all your details and all those things. And it's a simple question, yet profound. So the name of the podcast is the Smarter, Not Harder podcast. And we're asking everybody, what are 3 things that we all can do, in your estimation, your recommendation, to live smarter, not harder? It could be in your professional life, your personal life, anything in between. What do you think?
I think number one is having complete clarity of what your health is supposed to be, your financial means, your overall livelihood, your family, everything else, that overall clarity that you have. I think we forget to really have a good sit down and evaluate where we are, who we are. And so once we're able to answer those questions, the overall clarity of what you want to achieve and where you want to be, it's going to be a profound moment. Because if you don't have the overall clarity of what your perfect health is going to be, you're not going to be able to get there. And I see this a lot with clients when I first do a discovery call, where I actually ask them, if you could picture your perfect health in the next 6-month period, what would that look like for you? Unfortunately, about maybe 3 or 4 patients, sometimes in a year, may end up to say, you know what, I've been so chronically ill that I cannot even picture myself getting well.
Yeah.
Right?
Yeah,
It's a
totally.
sad scenario, but that's having a lack of clarity in terms of what their health is going to be. And so the overall work that they have to put through, they cannot do. And the same scenario with our finances and as well as our overall life. And so really have to picture what that overall clarity of that image is going to be in terms of your life. Secondly, in terms of making it simple, I think we're making functional medicine really complex these days. I think I actually said this on my lecture when I was at A4M at the beginning, is that functional medicine is becoming like the allopathic medicine at this point in time.
Yeah.
We're just randomly recommending several supplements without even thought process, right? There are tools, right? In certain cases, when you're starting out a complex scenario, you do need a lot of tools to making positive changes in the body. But as help to guide that particular client that we're seeing in a healthy scenario, do we need to give them 20 supplements, right? Is there other ways to really looking at these things? So this is a part that I really got into last year, looking at how light becomes a big major component as a nervous system, right? As long as you have those two things, looking at it in a holistic scenario, that we're able to help clients in a better ways in terms of waking up the right time, eating well at the right time, right? Having to have a sense of control in their overall life in terms of their nervous system, right? And then when you are having to overall control these things, having a sound body also affects sound microbiome, because the microbiome feels everything in terms of what you're going through, right? And another thing that I also like to teach my client is about heart coherency. And so that's a major component of how to regulate, but tapping into the overall intuition and the intelligence of the heart really teaches us to simplify our overall health, right? So because we're able to tap into the overall nature that we all have. So that's a part that I like to simplify and making simplify and making functional medicine easy. And then the last part is our overall our diet. I think there's too many programs and such. I think focusing on the right protein intake, which I recommend around 0.8 to 1 gram of protein per day, and focusing on
per pound,
correct. Sorry, ideal body weight. So I'm sorry, as well as adding in the right form of prebiotic, and as well as getting rid of all the toxins out. I think that should be simple enough for you to have a good diet. You don't have to spend a lot of money, right? To simplify that instead of actually trying to focus on, is this the Mediterranean diet going to work or that? I think simplifying into just enjoying your meal, but have a guideline of really focus on protein, healthy fat, the right amount of fiber and prebiotic. And then sometimes you want to have a cake, you could have that too.
Okay. You can have a cake and eat it too, is what you're saying. Exactly. Okay. I like it. Okay. I love it. Well, John, this has been great. I really do appreciate your time and expertise. I've learned a lot actually during this podcast. So I always enjoy speaking to colleagues that, you know, we talk all the time, but we don't get to talk in depth about things because, it's a fun way for me, egotistically and selfishly, to be able to ask questions on amazing, smart people like you. So tell me and tell the audience where they can find more about you, about your courses, and what's going on in your world.
Yeah, absolutely. So my course is going to start as of January 13th. It's called the Conquer the Mold Toxicity. So you could go to my website, kinwellness.co, and you're able to see a link that's there. And what I'm going to do is I'm going to offer Dr. Scott's listeners $500 off. So there'll be a special link that's going to be provided for you, for the listeners, as well as other resources in terms of how to calming your cell danger response. So that's going to be all added onto a particular special link for you. Other ways to find me is through Instagram. I'm very active there. My Instagram handle is john.pharmd. It's PHARMD, as well as YouTube that I'm trying to put more content on as Dr. Kim Wellness.
Awesome. Well, John, I hope to see you soon at a conference near you or me, or maybe near me so I don't have to travel.
So thank you. It was an honor.
And until next time, man, have a great rest of your day.
You too. Thank you.
Thanks so much for tuning in to another episode of the Smarter Not Harder podcast, where we give you 1 cent solutions to $64,000 questions. This episode was just fantastic to record. John did a fantastic job with just so many different medications that I threw at him, talking about antibiotics and SSRIs and PPIs and nutrient deficiencies, glyphosate, fluoride, methylene blue optimization, mold exposure. Go check out his mold course. If you like this podcast, don't forget to like and subscribe below. Share with your friends and family so they never miss an episode. We'll see you next time.